Cryotherapy also has short-term and potential long-term risks or side effects. Erectile dysfunction is a common problem after cryotherapy, although current techniques are trying to utilize nerve preservation just as in surgery, but the results are not currently available in terms of outcome. Urinary retention can occur following cryotherapy, and this may occur for weeks and sometimes even months, requiring that a catheter be left in the bladder. Bleeding from the urinary tract can occur, and injury to the rectum can occur with cryotherapy, which can create what is called a fistula, or a hole or communication between the urinary tract and the rectum. This is a very serious complication and in some cases might require surgical intervention such as a colostomy. If there is trouble urinating because of tissue that is blocking the urethra following cryotherapy, surgery may be necessary to open the channel as well. Long-term risks or complications of cryotherapy include those mentioned for the short term, but also would include the fact that cryotherapy may limit further treatment options, just as discussed for radiation. Similar to radiation, surgical intervention for removing the prostate may be difficult or impossible following cryotherapy. Tissues may not heal properly, and the risks and side effects of urinary incontinence and rectal injuries are substantial if surgery is necessary thereafter. Watchful waiting or expectant management does not have any initial short-term risk. However, the major risk would be that in the long term, if the disease progresses or spreads, it certainly can be life-threatening. A recent Scandinavian study has shown that when comparing watchful waiting to radical prostatectomy, in the first 10 years there was very little difference in terms of disease progression, disease symptoms, or death. However, between 10 and 20 years there was a substantial increased number of patients who developed progressive or advancing disease and died of their disease in the watchful waiting group as compared to the radical prostatectomy group. Watchful waiting, therefore, seems to be a reasonable option for patients who have a shorter life expectancy or obviously who are of an older age. It is important to understand that there is no absolute best treatment option for prostate cancer. This is a decision that must take into account your personal situation and should include your age, your general health, and the relative risk of your prostate cancer. Remember that primary goals of treatment should include, number 1, curing the cancer, number 2, preserving continence, number 3, preserving erectile function when appropriate, and number 4, maintaining a good quality of life. You should think long-term when making your decision. Don't be overly concerned with short-term issues such as length of treatment, etc. Once you make a decision, move forward and don't look back. Finally, I am excited about the progress that we have made in detecting prostate cancer early and in treating it successfully in a high percentage of patients. The future is extremely bright with much research being done in terms of prostate cancer treatments. This video is simply a general guide in understanding your options. Make sure you seek other opinions, take your time to make a final decision, and then move forward with optimism. Thank you.